welcome to another conversation on Awaz-e-Haqiqat. I'm your host, Chris Malika Bhadra, and depending on whichever part of the world you're listening to me from, I'm going to be talking about something that's very, very important when it comes to talking about women's health. I'll be discussing about endometriosis and all the other factors surrounding that issue because I feel that we need to be talking more about this. Many, many women I know, many women around the world suffer from this, and we don't have enough awareness. And on that note, I'm so honored to be having a special guest on my podcast. I'm joined by Dr. Nisha Khot, who is the president of the Royal Australian and New Zealand College of Obstetricians and Gynaecologists, RANZCOG, the peak organization representing ONG specialists and training the future generations of women's health specialists. She's also the clinical director of obstetrics and gynecology at Bayside Peninsula Health in Melbourne. She trained in India and the UK before moving to Australia in 2010. Dr. Khot also chairs the board of Multicultural Centre for Women's Health, a not-for-profit organization providing health education to women from multicultural communities. She's passionate about gender equity and diversity, especially in healthcare and leadership. On that note, Nisha, warm welcome to you. How are you doing?
I'm good, and thank you very much for having me, Chris. And what an important, topic to discuss today.
Absolutely, Nisha. So I'll get started with the first and a very simple question to kind of get a head start on this issue, Nisha. In your opinion, expert opinion rather, what are the standing and starting symptoms of endometriosis, and how quick is the turnaround for diagnosis in Australia?
So, Chris, first of all, it's really important to say that some people, some women with endometriosis might not have any symptoms at all. So
Mhm.
it's not necessary that you have to have symptoms. The most common symptoms that women present with tend to be painful periods
Yeah.
or heavy bleeding during periods, pelvic pain, so
Mhm.
pain that is there even when you don't have your periods, pain during sex if women are sexually active, and difficulty in conceiving. These are the most common symptoms that people
Right.
have. Sometimes they can have other symptoms, not very common, but those can be feeling tired, having a backache, having
Mm.
difficulty in sleeping,
Mm.
headaches, urinary symptoms, things like constipation. But these are very non-specific and they're not necessarily related to endometriosis. There might be a host of other reasons why
Right.
women might have those symptoms. As far as turnaround time goes, it can vary significantly.
Mm.
Now with increasing awareness, the turnaround time is getting shorter and shorter. But yes, it used to have a long turnaround time, up to sometimes even 2 decades before
Wow.
women had a diagnosis of endometriosis.
Wow. 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 I mean, yeah. Come to think of it, we have to thank science and technology, and especially how medical diagnosis is being changing around the world. Um, Nisha, when you talk about the symptoms and when we talk about how we treat the symptoms, what are the some of the pros and cons of hormonal therapies like birth control, etc., versus when you talk about surgery in terms of endometriosis?
So, usually, the first line of treatment, the first thing to try when women have symptoms is to try medical treatment because
Hmm.
obviously, surgery, one, will have a waiting period. You can't
Yeah.
just start surgery like you can start a hormone treatment.
Yeah.
And also, surgery will come with a set of risks that are
Mm.
related to having a surgical procedure. So, for anyone, I think the first line of treatment should be medical treatment, usually in the form of hormones. They may be pills, they may be an intrauterine device. The one group of women for whom actually this is not the right thing to do is women who are having trouble conceiving, because
Right.
all of the hormones that we are going to use as treatment
Mm.
are going to not allow a woman to conceive. So if fertility and conception is what is the primary aim of treatment, then
Mm.
that treatment needs to be surgical rather than medical.
Right.
Both treatments are very good options for treatment. Generally, you start with the medical treatment. If that doesn't work, then you go on to surgical
Mm.
treatment. It's important to note that surgical treatment works well for some people, doesn't work as well for some other people. It just
Mm.
depends on a few different factors. For example,
Right.
if you have an ovarian cyst, and that's the endometriosis you have, and
Mm.
that's causing you pain, then surgically removing that cyst is going to make you feel better. Of course, it is.
Mm.
Whereas if you have endometriosis that is not as clearly defined as an ovarian cyst, then having treatment might not improve your symptoms. So it's
Right.
important that when women make those choices, they have a detailed discussion with their provider to find out what would be best for them. What is a realistic expectation that they should
Mm.
have versus, if I say to you that, oh, your symptoms will all disappear and then actually they don't disappear after
Mm,
surgery, you're not going to be happy with that. So it's
absolutely.
important to be honest about what
Yes.
works, what doesn't work, and the extent to which it works.
Yeah. Doctor, just one quick question. What is the youngest age or what is the minimum age from when these symptoms start showing up in an individual's body?
They can start showing up right from when young girls start their periods for the first time. So,
All right.
as young as 12 and 13.
Wow.
There isn't really a minimum age.
Right. Thank you, doctor, on that one. And the next one is, when we talk about research funding and research progress, what are some of the barriers to endometriosis research awareness or funding?
I think the important thing is just research to do with women's health issues in the first place has traditionally not been funded very well. And so endometriosis falls into that bucket of, it's a women's health related
Mm,
issue. And so it tends not to get as much attention or funding. Also, the fact is that endometriosis has been sort of a Cinderella, condition. It
right.
hasn't been given a whole lot of attention, and that has also meant that there hasn't been a lot of research. It's good to see that that is changing and that there
Mm,
is more research and more interest in finding out what causes endometriosis, what works best for treating endometriosis. So that
right.
is really heartening to see.
Thank you. Thank you, doctor. Um, Moving on, when we say that we need more awareness, so the awareness needs to be both sides, right? In us as common citizens and also in the medical professionals as well. So when we talk about awareness in medical professionals, what are the most effective ways of educating them, like GPs in particular, across our healthcare system to maybe diagnose early symptoms or appropriate referrals? How better can we do that for the GPs and the system as such?
I think one of the most effective ways in making sure that people are doing, what is based on
Yeah.
the evidence that's available is to have guidelines. And we are so lucky in Australia that we have national guidelines on endometriosis,
Right.
which are available to GPs, specialists, and women themselves.
Hmm.
There's also something called a rate tool, RATE tool. It's easily available. If you put it into Google, it'll come up, and it's a series of questions that
Hmm.
patients, women themselves can answer those questions. And that, as they answer questions, that tool gives them information about the
Right.
symptoms they have and the likelihood that they may or may not have endometriosis. Similarly, they can do it with their GP. So when they sit down with the GP can open up the tool and you can answer those questions together. So that again, that means that you're more likely to make the diagnosis earlier because you
Yeah.
are looking for those symptoms and addressing them
Yes.
specifically. Of course, the mass awareness campaigns help. I
Hmm.
think what drives change often is when women ourselves, we say, hang on, I want to know if I have whatever XYZ. Could I
Yeah.
please have the test that would tell me whether I have this or not?
Absolutely. On that question of conversations, doctor, a lot of the times, if I just refer to the South Asian community, doctor, we kind of shy away, as you mentioned, talking about periods or pelvic plane and in open settings, right? Now, how can we best normalize having those conversations about our periods? Let's say in a clinical environment, school, or a social setting. How can we do that?
I think the more we do it, Chris, the more it normalizes. And
Hmm.
the less we do it, the more it becomes something to hide away and something to not talk about. And again, the thing is, when you hear someone else talk about it, as a woman of South
Yes.
Asian origin, you can chip in and say, hang on, that's a really important conversation.
Hmm.
I didn't realize that this is what you were suffering. Let me talk about it with a few other women. So when we lift each other, when we support each
Absolutely.
other to have those conversations, they become more normalized. They become things that we can talk about all the time. I think
Absolutely.
we really suffer from the effects of shame and stigma related to anything to do with women's health, especially if it has to do with periods,
Hmm.
symptoms of pelvic pain, sex and pain during sex. These are all things we just don't talk about. I
Right.
think the more we talk about it, the more we raise the voices of those who talk about it, the more it will normalize, the more we'll be open about these things.
Absolutely, Arpa. You've raised a very important point, which is living with the shame and stigma of these issues, right? Now, you also mentioned that endometriosis can come up as soon as you hit puberty. Now, it can have various emotional and psychological impacts because you're living with chronic pain, and how can that impact your normal healthcare system? Like a young girl with the pain, and that's affecting her emotionally. How does that impact her overall physiological and mental health?
We know that young girls who suffer from pelvic pain are more likely to not do well at school, especially less likely to take part in sports and physical activities, because obviously, when you're in pain, you're not going to want to
Mm,
do that. And that then has lifelong implications for women. So I think it's really, really important that we tackle this at a young age. And,
mm,
in Victoria, which is the state where I am in, there is actually now a program that is going to target young girls who have symptoms of either
mm,
period pain or heavy periods and give them multidisciplinary care. So care cannot just be medical care. It involves psychologists, it involves physiotherapists, it involves a whole team that then actually treat an individual not just as a medical patient,
yeah,
but as a human being who needs support to make sure that they can live their life to the fullest. And if we
absolutely.
do that from a young age, that will then have again a whole life cycle impact where this person will then continue to do the things, have a very full life
Mm,
because they've had the supports early enough. We know that once some cycles become entrenched, so that pain cycle, once it becomes entrenched, it's very, very difficult to break out of it as you get further and further. So
yeah.
the time to intervene is early.
Also, doctor, when this happens with young girls in schools, what is the role of the mother? Like, what should a mother do when the daughter says, Mom, I'm having this pain, I don't want to go to school, or no, because we are shy when the first puberty hits it. What does the mother have to do in that scenario?
I think, Chris, first of all, mothers tend to, and I will say that I'm a mother and I would probably also feel the same. I would think my child is just making it up. She doesn't want to go to school and that's
Mm,
why she's telling me she's got pain. And, this is just an excuse.
yeah,
I think at some point, we as mothers have to go, no, this is my child who is telling me that they are in pain. And so I should take that seriously and get medical help for them. So, as
absolutely.
mothers, that is one of the most important things we can do, not dismiss our daughters when they bring
Mm,
up things. And again, it's up to us to make sure that we take away the shame and stigma from it and normalize that conversation within our family, which
mm,
will then spread to outside the family. So, if there's a mother listening to this, if your daughter is telling you that she has heavy, painful periods, doesn't want to go to school, please take her seriously. Please go and see the GP, get help for her.
absolutely. Thank you, doctor. And on that very important note, doctor, now when we come to workplaces, right? Um, What are some of the examples of effective workplace support or management for employees with endometriosis? And if we don't have any, how can we better ensure that workplaces have systems in place to help their employees?
That is another very important issue, Chris. First of all, one of the things that if you have infertility associated with endometriosis
Mm,
and you are then needing to have fertility treatment, that is the one place where I think many employees now help their employees to make sure that they have access to leave, they have access sometimes to even financial help to be
right.
able to undergo fertility treatment. But that's a very narrow bit. Like not
Mm,
everybody with endometriosis will be going down the route of
yeah.
fertility treatment. And even if they are, that will be only for a certain period of time. It will not be across their lifetime. So, of course, workplaces do need to consider the effects of endometriosis on a woman throughout her lifetime and provide the required supports for her to be able to manage the condition.
Mm,
Sometimes, it might be that you need surgery. And in that situation, again, workplaces are usually very good with providing you with leave and things like that when you need surgery. But it's the bulk of the time is not when you're having surgery or having
mm,
fertility treatment. So I
yes.
think it's really important to recognize and allow for those special considerations for women who are really suffering from pelvic pain, from period pain, from
Mm,
heavy periods.
absolutely. Doctor, when we've talked about schools, we've talked about workplaces. Now, coming to individual households, right, doctor, what is the role of the partner in these sensitive situations when you see your partner is in pain or she's undergoing treatment, surgery? What role does the partner have to play in the household scenario?
Partners have the most critical role. And again, I will speak for the South Asian communities where generally partners may not take an active part in household duties. And I think this is the one time where partners should step up. This is a time when your wife, your partner needs rest, needs to be able to manage their pain. And this
Mm,
is the time for you to actually say, you know what, you need the rest, you should have it. let me take care of whatever it is, whether it is household duties, cooking, cleaning, that sort of thing, whether it is childcare, dropping kids off to school, picking them up. Those are the sorts of things that partners can and should help with. I
Right.
think sometimes when we put everything as the woman's job, no matter what she's going through, then it just exacerbates. Because if you are in pain, but you know that there is no one else who is going to help you with all
Mm.
the jobs you have to do, you're going to do those jobs, and the stress of keeping up with that is going to make your pain worse. We know that pain is one of those things that gets exacerbated when you are stressed. And
Yes.
so, actually, taking the stress away from a situation and allowing someone to rest makes that pain better, even without the need for painkillers sometimes.
Mm.
So, that is a very important thing for partners to realize.
Absolutely, doctor. And one more thing, doctor, I wanted to ask you this. You and I are sitting in Melbourne, Australia, is pretty much right at the top of the things when it comes to awareness and um, more conversations. But there are many parts of the world, since we both are South Asians, in the South Asian belt, there's a lot of more awareness that's needed. How do you ensure to raise more awareness in those parts of the world, doctor, where there's not enough adequacy or information available?
It's again having the discussions. First of all, as colleagues, I trained in India. So my
Mm,
colleagues still practice in India, and it's having the conversations with colleagues, because sometimes it is, like I said, we have a guideline in Australia on
mm,
endometriosis. People here have already done the research and
mm.
the work. It doesn't need to be reinvented. It can be taken as it is and applied in any country
Right.
based on the resources that are available in that country. So I think there needs to be a whole lot more sharing and talking to each other. And of course, raising awareness among the population is another thing that we as South Asian women can all do, because we probably still have connections in our home countries with friends, family members. Start the conversation in your own little circle.
Yes.
Once one ripple will lead to further ripples, and that's how awareness will spread.
Absolutely. Thank you, doctor. That was very important. And now coming to yourself, doctor, on a difficult day when things get going or there's too much on your plate, how do you take care of your mental health?
Well, when things get difficult and when, there's a whole lot of stuff happening, I usually get my dogs and take them for a walk,
Mm.
because that really helps clear my head. Going out into the open is what, some people like going to the gym. I really am not a gym person. I don't like being indoors. I like being outdoors. Having the dogs with me calms me down very
Yeah,
nicely, and breathing in fresh air helps clear my brain. So, all of those things put together is my way of dealing with a really busy, hectic day. The other thing I do is on Saturdays, I go to Park Run. Park Run is a free community activity. You don't have to run. It's a 5 kilometer run, walk, whatever you feel like doing. Every Saturday morning at 8 a.m., you will find one close to wherever you are in Australia or even in other countries. It's a really good way of keeping physical activity at the
yeah,
top of your agenda, starting your weekend being physically active, and just clearing your mind again of all the things that have happened during the week and giving your weekend a great start.
absolutely. Absolutely, doctor. And if any of our listeners would like to reach out to you, would like to connect with you, where can we find you on social media?
I am on social media on Facebook, Nisha Khot. I'm on Instagram at Nisha OBGYN. So, yeah, find me on both of those places. I'm
Thank you,
also on
doctor.
LinkedIn if they want to reach out via LinkedIn.
Sure. Thank you, Doctor. It was a pleasure having you, and this was such an important conversation because I think more and more awareness needs to be had, as you mentioned, and more conversations need to be had. To our listeners, if you've heard us for the first time, I really hope that you had a lot to take away from Dr. Coates' words of expertise around endometriosis, awareness, diagnosis, and care. And if you've heard us for a while, I hope that you like the content that we put on the table. If you've got any thoughts or comments on this conversation or any of the conversations, please write to me, or and I'm also available on YouTube, Facebook, and Instagram. On that note, Dr. Khor, it was a pleasure having you, and maybe have many more of these engaging conversations in the future. Thank you so much for your time.
Thank you.